Hi, my name's Kerry. I'm a lactation consultant and midwife here at Albury Wodonga Health, Wodonga Campus Maternity Ward, and I'm also part of the midwife care team. I'm here to just do a short video on breastfeeding. This is just the start of some talk about breastfeeding. It won't talk about everything you need to know about breastfeeding. At the end of the clip, I will give you some other resources you could use to go to find out a little bit more about breastfeeding. The main topics we will cover today is the first hour, rooming in, attachment and demand feeding. Lots of different women with different shaped breasts and sizes can breastfeed. Lots of women that haven't been successful with their first also can breastfeed with their second, third. So it's important just to ask for help along the way and let us know any worries you may have. Enjoy the next clip. So let's talk about the first hour after your baby is born. Healthy newborns are placed skin to skin with their mothers, and this skin to skin is so important as it keeps the baby at a perfect temperature and also stimulates natural feeding instincts in the baby. Your baby will benefit from the rich and protective first milk called colostrum, and it will also help the uterus contract and help with the birth of the placenta. This time of skin to skin with your baby is good bonding time for you both. Your baby will often lay on you quiet but alert. Skin to skin contact is just as important in the days and weeks following the birth. So this next part I'm going to talk to you about is attachment of your baby. So it's important to have your baby chest to chest with you. Otherwise, if they're faced around like that, they have to turn their neck, and that makes it difficult for them to attach and to also swallow. So whichever way you're positioned, whether it's laying down or got your baby across, make sure they're chest to chest so that they don't have to turn their head. What you then need is for your baby to take a nice big mouthful so they don't only grab hold of the end of the nipple. Your baby needs a big mouthful so they take in the dark areola bit around your nipple. Then your nipple goes far enough back in their mouth that it shouldn't feel like it's pinching or rubbing. It goes so far back that it actually hits the soft palate in the baby's mouth. So then when they're attached, they've got a nice deep attachment, and they're stimulating the whole area around the breast, which helps with supply as well. The third topic I'm going to talk to you about is rooming in. Rooming in is where, if you and your baby are healthy, the baby remains with you in your room. Rooming in is an important part of your stay in the hospital. This is the time when you start to bond with your baby and start to learn what their different cries and movements mean. With breastfeeding, when they cry, that is considered a late feeding cue. However, there are some early feeding cues that can help with breastfeeding. Early feeding cues include when the baby starts stirring, they start licking their lips, or they just start opening their mouth. The baby generally attaches better when you recognise these early feeding cues. The last topic I want to talk to you about is demand feeding. Your baby's stomach is only small. In the first few days and weeks, your baby will need to feed frequently. This frequent feeding will also help with your milk supply. Breast milk is easily digested by your baby, and it is quite common for breastfeed babies to feed between 8 to 12 times in a 24-hour period. This usually means that your baby will breastfeed on average every 2 to 3 hours around the clock, day and night, with possibly one longer stretch between feeds, somewhere in the 24-hour period. The length of time between feeds can vary greatly from baby to baby. Newborns also tend to have periods each day where they feed very frequently for a few hours. We refer to this as cluster feeds. Often these cluster feeding periods are followed by a longer stretch of sleep. I am often asked, how long should a baby breastfeed for? Every baby varies in the amount of time they will spend at the breast. Some babies for 5 minutes, some babies for 55 minutes. Some babies will feed on both breasts each time, and other babies will feed on only one. Nighttime feeds are just as important. They are an important time for bonding, for you and your baby. And also the hormone that produces milk called prolactin is higher at night. So nighttime feeds help with your milk supply. Some newborns are extra sleepy and may need to be woken for medical reasons like jaundice, infection, or if your baby is born early. So that ends our short clip on breastfeeding education. As mentioned, there's a few different resources you can look up both antenatally and the other resources that will help you postnatally. A really good website is the Australian Breastfeeding Association. It has an amazing website on everything breastfeeding. They also do antenatal classes, and they also have 24-hour counselling service. So if you find that you're struggling day or night once the baby comes with breastfeeding, you can ring and talk to a counsellor at any time. Also, another resource within the hospital is the Breastfeeding Support Service. You can self-refer or you can be referred by a professional. There also is lactation consultants on the ward during the week. Another good resource is your maternal and child health nurse in Victoria and your child and family health nurse in New South Wales. I hope you've enjoyed the short clip on breastfeeding. Thank you.